So, welcome back. Today, we'll be talking about mixed connective tissue disease. It is a fairly newer disease in that it was first described in the 1970s. And as the name implies, it is a mix of other autoimmune rheumatological diseases. Specifically, it is a mix of rheumatoid arthritis, lupus, scleroderma, and myositis. So, what the symptoms of mixed connective tissue disease can be many, but the most common is the Raynaud's, and this is where the patient's fingers will turn white and then purple and then red with even a slight decrease of temperature or if they're holding anything cold. These patients can get an arthritis and specifically they can get very puffy fingers. These patients can get myositis or muscle weakness and specifically they can get esophageal dysmotility so they can get trouble swallowing their foods and a lot of heartburn. They can also get skin changes. Most commonly are the photosensitive rashes, which means these are rashes that get worse in the sun, and they can also get some skin thickening. And then these patients can also get heart and lung problems. They can get an autoimmune lung problem that is specifically called interstitial lung disease, where the immune system is attacking the lung tissue, and they can get pulmonary artery hypertension. It's a sign that the heart is working too hard, so it's a high blood pressure inside the heart. And they can also get some nerve stuff. As far as who gets mixed connective tissue disease, so just like all the other things in rheumatology, it is very rare. I would need about 100,000 people in a room for even one person to get it. It is more common in women, and it can happen at any age, usually like around the ages of 4 all the way up to 80, it's been reported. However, it usually happens most commonly around the 30s. And in these patients, there is a genetic part to it, but it's not fully genetic. As far as the diagnosis of mixed connective tissue disease, again, just like everything else in rheumatology, is taking what the patient is saying, matching it up with their body. And in this case, we do have a lab test that's a little bit more specific or a little bit more unique to these diseases. And because this disease is so rare, making sure the patient doesn't really have rheumatoid arthritis or lupus or scleroderma, maybe they have another disease instead. So in these patients, we are looking for that Raynaud's, we are looking for that arthritis, those puffy fingers, we are looking for that trouble swallowing, that myositis, we are looking for those rashes, the skin thickening, and then we are looking for heart and lung problems. As far as the treatment of mixed connective tissue disease, it has to be divided up into two parts because some of these problems need autoimmune medicines. It's where the immune system is becoming overactive and specifically attacking certain things. So we use our autoimmune medicines to push that immune system down and the disease goes away. But then there are other problems where autoimmune medicines are not helpful. And in these cases, the patients will need specific medications for that specific problem. So I'll give you an example. If a patient with mixed connective tissue disease comes to me and they're short of breath, I have to look a little bit further. And if it's from lung disease, which can be from ILD, which is autoimmune, I can increase their autoimmune medications and calm the immune system down and the disease will be controlled. However, if they're short of breath and I investigate and it's actually coming from their heart because there's a high blood pressure in the heart, then they will need specific heart medications. As far as the prognosis of mixed connective tissue disease patients, like how do these patients do long term? Well, it really depends. So if these patients have that lung disease or they have that heart disease, it can be a little bit more serious and it can affect how they do long term. If these patients change into something else, meaning that less than half of these patients will change into rheumatoid arthritis or lupus or scleroderma or myositis, and then how will they do really depends on that underlying disease. But more than half will stay mixed connective tissue disease their whole life, which is why you often see rheumatologists follow these patients out for a good 10 years to see which way they will go, because it becomes more of a time will tell type of thing, because we really can't predict 100%. As the ancient Greek Dr. Galen would say, the physician is only nature's assistant. Until next time.